Crohn's Disease 101. Part of being human is accepting that our bodies don't always work the way we'd like them to. And that's particularly true when it comes to autoimmune disorders. These are conditions where your immune system is triggered by your own cells, attacking your own tissue and creating all sorts of problems that aren't easy to deal with. One of the most common autoimmune disorders is inflammatory bowel disease, or IBD, but that name can be a little misleading. That's because IBD is not a single disease. There are actually two main types of the condition: ulcerative colitis and Crohn's disease, which is what we're going to be talking about today. Crohn's disease is a chronic condition, meaning that you can have it for an extended period of time, sometimes for your entire life. And since it's usually diagnosed in your younger years, generally between the ages of 15 and 30, that's a long time to suffer through some very unpleasant symptoms. So what does Crohn's feel like? The most common symptoms include abdominal pain and diarrhea, sometimes with blood, along with fatigue, fever, and weight loss. But you may be surprised to learn that Crohn's symptoms can appear outside of the intestines too. In fact, other frequently encountered signs include anemia, arthritis, inflammation of the eyes, and skin rashes. How can that be? Here's how gastroenterologist Erin Forster describes it.
Sometimes the IBD can be preceded or followed even by what we call extraintestinal manifestations. So these are findings that, on your body that are associated with this condition, but might not always be so obviously connected. We have joint conditions like certain joint pain, ankylosing spondylitis, or other what we call arthropathies, or inflammatory conditions of the joints. There are also dermatologic conditions, ones that are painful bruising on the shins, or kind of another erosive condition of the skin called pyoderma. Sometimes we share patients with ophthalmologists. A patient might have redness of the eye or painful swelling of the eye like uveitis. And so we are often co-managing these patients with the specialties that I just mentioned.
Your symptoms can vary tremendously, not only from what other patients go through, but from what you go through at different times. Some patients experience just a few symptoms, while others get them all. Some patients have only mild cases, while others are severe. And sometimes you can even go into periods of complete remission where you don't have any symptoms at all. We're not entirely sure what causes Crohn's disease, but researchers believe that certain factors may play a role, including genetics, exposure to environmental triggers, and an overactive immune system. It also seems to be more common among those with Eastern European backgrounds, particularly Ashkenazi Jews, and there's been a recent increase in the number of African Americans developing the disease as well. Location may even be a factor, with those living in urban environments and northern climates more likely to become patients than those in other locales. There are a couple of things that we do know don't cause Crohn's disease. Sex doesn't seem to make a difference when it comes to who develops the condition, and factors like stress and diet don't seem to bring it on either, though they can make your symptoms worse. If you have the feeling that your symptoms might be Crohn's disease, the most important thing you can do for your health is see a doctor. The signs you've noticed may very well be Crohn's, but there are other conditions they could be too, so a full professional evaluation is a must. You'll usually start with a medical history, have a detailed conversation about what you're going through, and then have testing done to help pinpoint what's really going on. Here's Dr. Forster again.
We often do blood work and stool testing to start. We often combine this with cross-sectional imaging like a CT scan or an MRI, depending on patient-specific factors. And I am an endoscopist by trade, so oftentimes it will include a colonoscopy so we can get a direct visualization of what's happening on the inside, because sometimes the tests I've just mentioned don't give us 100% of the picture. And often that intestinal ultrasound can add another piece or layer to the puzzle. So it won't just be one straight test, like, for example, if you're having your blood pressure measured, but rather an aggregate if we put all of those pieces together to determine, does this seem like Crohn's? Does it seem like ulcerative colitis? Or does it seem like something else?
If you are diagnosed with Crohn's disease, the good news is that there are a lot of ways to manage it effectively. some of which you can do right on your own, and some of which require working closely with medical specialists. Many people start by looking at their diet and lifestyle. Some foods can lead to digestive distress, and when you're living with Crohn's, that's the last thing you want to have. For example, for many people, dairy products can cause diarrhea, gas, and abdominal pain. As many as 30 million Americans are lactose intolerant, particularly among the Asian, African American, and Native American populations, and eliminating dairy or using a supplement like Lactaid can really help with symptoms. And dairy is just the start. For many patients, high-fat foods, spicy foods, alcohol, caffeine, and high-fiber foods can all worsen symptoms. Try keeping a food diary to help you identify any foods that might trigger your Crohn's symptoms. You can download a free tracker at nafc.org. Multivitamins may also be worth considering, especially because many who suffer from Crohn's disease often don't absorb nutrients as well as they should. Quitting smoking can be helpful because smoking has been found to aggravate inflammatory conditions like Crohn's. And since stress can also worsen your symptoms, try taking up activities like meditation and exercise to reduce the stress you are going through. Beyond lifestyle changes, today's medications can be very effective in your fight against Crohn's. There are immunosuppressants which reduce your body's production of chemicals that promote inflammation, biologics that neutralize the activity of certain proteins that produce inflammation, and antidiarrheal medications that can bulk up your stool. But do keep in mind that some medications can actually aggravate your symptoms, so don't take anything without talking to your doctor first. Finally, if medications aren't enough to get your condition under control, surgery may be an appropriate option as well.
Sometimes surgery involves elective removal of certain parts of the colon or small intestine. Sometimes it can happen a little bit more urgently if there's issues with infection or other more serious complications like fistula. But we really believe that the best IBD care happens in the outpatient setting rather than in the hospital. So we try to run a tight ship outside of the hospital, but sometimes hospitalizations are required and sometimes surgeries are required.
For some patients, surgery can actually eliminate symptoms entirely, though they may return later, sometimes even years down the road. Some patients may also benefit from a second procedure, usually performed about 10 years after the first. Of course, surgery isn't right for everyone, and there are potential complications you'll need to weigh carefully, which is all the more reason to develop a relationship with a physician that you know and trust. With professional support, today's treatment options, and an active approach to managing your health, Crohn's doesn't have to sentence you to years of suffering. Visit the National Association for Continence today to learn more about the steps you can take to get on a path to a symptom-free life.